you have permission. I wasn't sure if I'd given it to you before to record.
Okay, perfect.
Do you want to just jump in, Phil, or?
Yeah, we'll just get started.
Okay. Do you want me to kick it off?
Well, I just need everybody's name and their relationship to Rita. This is my first time doing a story with you guys.
She's singing happy birthday.
Uh-huh.
Her rendition.
Sandra, do you want to start by just saying and spelling your name for him and
Sure.
what your relation is to?
Sure. Sandra Whitcomb, Whitcomb. I am Rita's youngest grandchild, and I am local here in Rochester. I can't wait to see her when everything gets opened up. On my lap to the left, I have Amelia, who was named after my grandmother. Grandma's middle name is Amelia, so she will be 2 in July. And to my right is Mackenzie, Grandma's adopted great granddaughter, who is going to be 6 in about 2 weeks. Behind me is my daughter, Jessie, Grandma's great granddaughter. And then to the far right is Heather, my grandmother's Holy, because she always wears Holy jeans when Grandma used to have her apartment. So we're all here. My son is at work, so he couldn't make it. So I'll pass the ball off to Lisa.
Yes, hi, my name is Lisa Richards, Richards, and I am the recreation manager over here at Edna, where Rita is staying with us. Yeah, and very happy to have her. We came to see Rita back in September of 2015, and it's been a joy every day having her here.
So let's just start with getting a little background. Just talk about, how Rita was able to get the vaccine on her birthday.
Yeah, well, actually, her birthday's today. We did give vaccines out to our staff and to our residents yesterday. So what myself and my coworker, Crystal, we decided to kind of go around and, get people's backstories of why they wanted to get the vaccine. We reached out to staff and to residents, and we heard that Rita wanted to get the vaccine. And so when we approached her and asked her, you're going to get the vaccine today and tomorrow is your birthday, she just kept repeating, happy birthday to me, happy birthday to me. So we said, well, why is this so important? And she says, you have to take care of yourself. And I take care of myself. And that's why I'm 104. So, and then she kept repeating, happy birthday to me. So that's a pretty awesome gift.
No doubt. And for the family, Sandra, how does it feel that this virus has caused a lot of harm to our families and our communities? To know that your grandma is doing all that she can to protect herself.
It's great to know that the staff at Rochester Regional Edna have such a great handle on everything to keep her safe. It's very hard not to go down and visit because she is 104, her hearing is going, her eyesight isn't the best. So it's hard for her to see. So when we do video chats, it's very good because she's closer to us. We did do on my birthday in September, I actually had a face-to-face. And it was hard because we were both masked. We were 6 feet away. I just wanted to run up and break all protocol and give her a big, huge hug. But I didn't, so that I didn't get yelled at by Lisa. But it's wonderful. And I am so happy that the residents and the staff of the nursing facility were able to get that first. And I'm scheduled on Tuesday to get my first vaccine shot. So fingers crossed, I'll be able to get in to see her soon.
That's wonderful, because it seems like, your grandma is a very special person to you. Just talk about, that.
Yes, she is being the youngest granddaughter and having two grandchildren that are local, we spent a lot of time at my grandmother's before she went into Edna. At least once or twice a week, if not more. We would take her out to lunch. We would take her out to dinner. Lots of fun stuff. And she actually, growing up, she was a very big part of mine and my sister's lives. She took us to Hawaii. We went on many, many vacations. And even when my mother, who was my grandmother's daughter, passed away, my grandmother was right by the side with us. So she's been a very big, she's a matriarch of our family. She, you know, and she'll tell you like it is. Lisa knows that as well. So, but, you know, for her to have survived as much as she has survived 2 husbands, 2 of her 3 children have passed away. And all of her siblings have passed, and she's the oldest of her siblings too. So, it's, you know, it's amazing. And she'll always tell you too, that growing up, she only used oil of Olay on her face. She never used soap. She never, you know, she never colored her hair. So she's just basically all natural, always has been. So.
And definitely, and, you know, if, you know, there's got to be so much anticipation. You said you were going to be planning on taking the vaccination next week, but, you know, just talk about the anticipation of actually being able to physically see your grandma and give her a hug.
Right. That's the hardest thing, not being able to hug her, give her a kiss, just hold her hand. Because there were times when we would visit at least once a week to the nursing home. If she wasn't getting her nails done, I was doing her nails, and just holding her hand, all of us, when we would wheel her from her room to the dining room or to when we brought lunch, she was always holding someone's hand. She has a very big sense of touch. So it's very hard. And she always blows kisses when we do video chats as well. So I can't wait to just hug her as big as I can without hurting her, because she's so frail at these days. So it'll be nice to have that physical touch.
So, Lisa, a question for you now. You know, with these vaccinations, it solely means we're starting to getting closer to normal. Basically, you know, it's been a change for you guys as well, because you haven't been able to see, you know, the families, you know, get closer together, you know, hug, and because the pandemic's changed a lot of that. So, you know, how exciting is it for you guys that, you know, the families like Rita's will be able to kind of reunite in person as we continue this vaccination?
Yeah, we cannot wait for that day. You know, doing the in-house visits, but with the social distancing, like Sandra was saying, it was nice to finally see them come in, but it was also hard because there was no physical contact. You know, they had to social distance, and you know, and it was kind of difficult on the residents and like Rita, because, you know, again, you know, it's hard for them to hear and see them, but that day now, and I'm hoping now that we've got the vaccine out and we're heading in the right direction, and hopefully this is the answer to kind of go back to some kind of normalcy. I want to have the biggest blowout party. I mean, we're known here at Edna in our recreation department for our socials and our gatherings and our entertainments, and I'm just waiting that day when they give us that go ahead to have that party and to invite the families back in and to have the residents again gathering, and just to, like Sandra said, just for them to just hold their hand and just be able to see, you know, each other up close and give kisses and hugs. That would just mean the world to all of us here, and, you know, all of us that work in long-term care. It's just, we're always their family, but we've really become their family because the families outside just can't come in and do that. And that's what we're providing for, not just Rita, but for all of our residents.
Definitely. And I think, let me see something. Let me check my list real quick. And back for Sandra, just talk about she is a survivor, and her willingness to take the vaccine just attributes that. Just speak to that aspect of your grandmother.
Well, she was a nurse. She was a private care nurse, as well as she worked in hospitals as well. So for her to do that, I knew there would be no question in my mind that she would do that, because she's been such a pioneer in so many things that she would want to be able to say that either she helped someone else as well as helping herself.
Now, either of you, is there anything else you would like to say about Rita, or about the vaccinations that I didn't ask you about? Do you want to make sure the public knows?
Honestly, I to be honest, when I was able to, because I do some healthcare, that's the only reason I was able to get on the list for the vaccine. I would have jumped in front of people to get on the list so that I could be able to see my grandmother quicker. And when they called me to ask if she had permission as well, even though she gave herself permission, I said, absolutely. She would want to have that, because she would want to be able to see her friends and family, as well as help anyone else that would be able to see their friends and family before anything, drastic were to happen with any of them. So.
Okay.
I'm just going to say, I think Rita has a lot of courage, to be at 104 and to be that brave and to get that vaccine and know that she's doing it not only for herself, but for her family. I think that's a very brave and courageous thing for her to do. And that just sounds like Rita. It does.
I agree. And Lisa can attest that she definitely is a Spitfire, and she will tell you or spell what she needs, or what
yeah.
she spells everything nowadays. So,
Yeah.
which is great for her mindset as well as her well-being.
Mm-hmm.
I honestly cannot thank the staff at Edna enough for dealing with me and the other families, for the amount of stress that they have had to go through, probably with all of the regulations, and not being able to see friends, family, and visit the other people, because there are so many people that are now part of my family that work at Edna. The nurses, the aides, Lisa, Crystal, Kim, who just called, and we're gonna do our 4:00 birthday now as well. So
Awesome.
they have become part of our family as well. And we're very blessed to have them.
Thank you.
Awesome. That's all I have. Thank you guys so much for your time. And I intend to have the story air later tonight.
Wonderful. Thank you.
Thank you so
Sorry
much.
for the distractions. We thought it would be nice to have the kids on there.
Thank you, guys.
You
And
can edit that all out, Phil.
And Phil, just so you know, you guys have done stories on Rita. Brianna did one a couple weeks ago, and then Spectrum was there for, I'm not sure if it was her birthday last year or the year before. So there is other footage in the system should you want to find anything, just so you know
Right.
it exists there.
I think it was 103. And then I think it was 3 weeks ago, we did the Girl Scout thing that Lee did an amazing job with as well.
Yeah.
Yeah, and she's been in the newspaper, et cetera, for things like that. But with Spectrum was there last year. So.
Let me just stop.